You're listening to On The Docket with Napoli Shkolnik.
Welcome to the next episode of On the Docket by Napoli Shkolnik. I am Mary Ann Candelario, and I am a partner at Napoli Shkolnik. Today we have with us Dr. Nicolle Valle Rainmundi, and we are here to talk about nursing home negligence. We want to talk about what happens, how things happen, and what we need to look for. Now, clearly, when we talk about nursing homes, the first thing we think about is it's our loved ones. It's a family member, right, Nicole?
Yes.
That we have to make a decision as a family member that we can't any longer take care of them for many reasons. And can you tell us in general what
Yeah.
kind of reasons
So,
those are?
first of all, it depends on the medical condition that your loved one has, and at some point, we're just not able to take care of them as better as we would like to, and therefore that's why we search for such facilities that we search for them in terms of feeling comfortable and reassured that they will get the care that they need. And unfortunately, sometimes even though we put our trust in them and take our loved ones there because they need either constant monitoring or maybe because of their inability to be able to do all their daily activities by themselves, they need assistance. So they have to be someone like 24/7 looking out for them. And it is a really tough decision for families because it's not even just thinking, am I able to provide the care needed by our loved ones, but also the fact that I cannot provide the care they need, but I also have the responsibility to keep working so that I can provide in terms of like running with the cost of nursing homes,
Exactly.
which we know that it's not something that it's accessible for everyone, even though health insurance are supposed to cover for some parts. It still has a toll on the family.
And they don't cover for everything either,
Exactly.
which is another issue that we'll talk about in a minute. But so you talked about, how it feels for the family members, which is huge. I'm old school. I feel like, my mom and dad took care of me from the day I was born. They did everything for me. And now it's going to be my turn to take care of them. And I work just like you do. And the guilt is tremendous. So I sympathize with all the people who have to put their loved ones in nursing homes because of all of that. So Nicole, what are the things that people should look into before selecting a nursing home?
Okay. Like first of all, from a standpoint of like putting ourselves in the place of the caregiver, for me, a big red flag would be a place that you're not able to visit whenever like you would like. I know that they have visiting hours, just as we're used to knowing that hospital facilities have visiting hours, but a place that you need to like schedule a visit, that for me could be a red flag because why am I not able just to walk in whenever like it's available for me when I have the time to go visit them? Like, are you hiding something and you just want the family members to visit the residents at a specific time, maybe just because it's a time when you have like everything prepared and the perfect picture that everything is it's running the way it's supposed to be running. So that's the first. And then communication is key. Like family members they put their trust at the nursing home facility and at their staff, just relying on them to care properly for their loved ones. So there has to be like very honest communication between both sides. Like if there are any changes in the treatment that the patient receives due to maybe they develop a new medical condition that wasn't present at the time that they were admitted to the facility, the family has to be informed. There's always a next of kin reported in the client's
In the initial admission
exactly
chart records,
in their
right?
chart. So there's always someone appointed to whom they have to communicate with in order to make decisions. Like their care plans have to be discussed with the family, and also the family members have to feel confident and reassured that they are allowed to ask questions. Like, I went to visit my mom or my dad, and I noticed that I've been seeing him for the past months, and I've seen that he has been losing weight. Like, what's going on? You can ask for that. And what's going on is, are they not eating well? Do they just simply don't like what they are being given for to eat? Have there been any changes in like any medication that's like decreasing their appetite? It can be so many things, and I believe that the worst question is the one that you withhold and that you don't ask.
Absolutely.
So they need to feel free to ask about anything that might be like a flag to you, because nobody knows your loved one than yourself.
Absolutely. And that's, as simple as Googling the facility. Do some homework, right? To
Check
see
for
what
reviews.
exactly, see what other people who have taken their loved ones to this specific place you're looking into have said. There are different state websites that you can also look to see if there have been any violations, citations, etc. So that's another resource to first look into this specific place.
Exactly. And the same goes for there's always like a attending physician for each facility. They're not at the facility 24/7, but each nursing home has a physician assigned for them just to provide like primary care for the residents.
Right.
And all of that is included in the nowadays everyone has a website for their facility, so you can go and check who's the physician, who's the supervisor of nursing,
Right.
who's the social worker, and you can just check and see any reviews in regards of the staff and the experiences of other families.
Absolutely. And so all these things are important because obviously we want to try to find the best fit for our loved ones. Now, all these reviews can be spectacular, right?
Yeah.
All these doctors, attending doctors, the director of nursing, everyone who's typically involved in a nursing home can seem on paper to be perfect. And then, what are some of the red flags that indicate to us maybe not everything is as great as it sounds? Especially, for example, the fact that, most of our family members who have to go to these nursing homes are compromised mentally. Some of them have dementia. There's so many different things. What are some of the red flags that, other than the things you have mentioned about losing weight, et cetera, what else do you think are red flags for family members to look after?
Okay, so based on what we do here in the firm as part of the medical team, we look for specifics during our review of the medical records. And for example, we start with what are all the medical conditions that the patient has, and then after that we check on medications. And because they go in once they're admitted, they have a regimen of medications for the specific diagnosis that they have, but there comes instances that they gain new diagnostics within the time of their stay, either because they contracted something because they were sharing a room with another resident, and that resident had a cold, and so our client got infected with the same virus or bacteria that might have caused that.
And I'm going to try to stop you there for
Yeah.
1 second, Nicole, because I want to backtrack. Very important that you brought up our clients. So at Napoli Shkolnik, we have a team of doctors. They're physicians, just like Nicole. I call her Nicole because I've known her for a few years and we work together a lot. And we can provide to them the medical records to review. They dissect them, we sit with them, we review them together because we're trying to get to the bottom of what happened here. Why is our loved one in the condition that he or she is? And, what did they do wrong? These
Exactly.
facilities. And so we are very fortunate that in our firm, Napoli Shkolnik, we do have a very qualified team of doctors. So, sorry, let's go back
Don't
to
worry. So,
the red flags we were
yeah,
talking
so
about.
as a team, we're always looking because when we received a case, like the family members, they might were able to point out a specific thing that they think wasn't done properly, or something that maybe a medical condition that wasn't treated in a timely manner, or that they weren't very communicative and they learned about things that happened during their stay at the nursing home, like maybe weeks or months later, or when something recurred, for example, a fall, like maybe our client fell like a month ago and no one contacted the family to tell them that something had happened.
In fact, Nicole, we have a case that is very disturbing. We've talked about it many times. A client who fell over 20 times in this nursing home. The family members had no idea how many times this person, and we cannot mention names, obviously, and it is outrageous to me when we talk about it, how this can happen, how things are not done to protect these poor people who are in a position where they can't always communicate, how they're feeling. And this one patient, with this one client I'm referring to, she in fact had fallen and broke her hip. She broke her bone. She was in pain for days. 3 days went by and they didn't send her for x-rays. And when they finally did, she had to have surgery, like intensive open reduction. They went in, they had to put hardware. And those are the kinds of things that we want to make sure that these nursing homes are made accountable for.
Exactly.
And, that one case to me is, it breaks my heart. It breaks my heart. And, what else do you think we should
Cases
be
like
looking
this
at?
it's, for me as a healthcare provider, like, we know we're here to serve people and just to provide the best care that we can for them. And for us as in the medical team, like, that's something that it's like at the top of our list. Like, standards of care are the utmost important thing in regards of when you are a facility when you have residents at your care. And the thing is that if you are that type of facility, either a nursing home alone or a nursing home along with rehab, like there's a purpose that you exist, and they are sent to your facility so that you can provide the proper care. And if it's for rehabilitation, then they get physical therapy and occupational therapy to gain the best mobility or functionality, because they have short-term admissions, which are just because our client had a surgery and they need therapy to be able to have a very successful recovery. And at some instances, it's just because they all are at an elder age, and so now the family cannot provide care for them. So once they get there, you're trusting that they are providing and doing things accordingly to the standards of care for health.
Right.
And in healthcare, we have protocols for everything. And at the in terms of falls, facilities have to put in place a first of all, they need to do an assessment upon admission. You need to check up the patient from head to toes, because it's either they are coming to you from their home or they are being transferred from a hospital.
Right.
And for us, that's like the admission note for us is key, because they are supposed to check up from head to toes everything, bruises,
Bed
any
sores.
bed sores, labs. Because, for example, diabetic patients, they are at risk for a lot of other conditions. And if it's a patient that it's not that has a compromised mobility, then that risk increases.
Right. What kind
So-
of things can they do, or they should be doing, if a patient, resident comes in and they are a fall risk, meaning they are known to have falls regularly? What kinds of things can they do?
Okay, so I mean, all facilities have a protocol. At they tend to, like, we can say, customize it to their own like way of how they provide care. But in general, the basics are you need to, like, their bed needs to be on the lowest position that you can put it, because in case they turn over or something and they roll down or fall down from their bed, if it's a shorter distance, it's a better outcome for any injury because it lessens the
Right. And it sounds like a very simple thing to do, right?
Yes.
Lower the bed. Now, what happens that these things are not done? Do you think maybe like not having enough staff? Or
Understaffing is a fact, but then there's also the point that that's not on the resident. It's not on our clients that the facility didn't have the sufficient amount of staff to provide care. So you need to think, I have a certain amount of staff, so I should only be able to admit a certain amount of residents.
Right, exactly. I was doing some reading, and I was appalled to read that New York State is typically in the bottom 10 for rates of understaffing, in nursing homes. Bottom 10. A big state. It is just incredible to me that they would allow something like this to happen.
And that's something that we look for in medical records. It's not only on the physician, it's not only on the supervising nurse or the registered nurse that was on the shift that an incident happened. It's also on the social worker. Like, we look into all the staffing that was in direct contact with our client, because maybe someone, I don't know, they were like on a double shift or something like that, and they were tired and they didn't saw like any signs that something was going on. Everyone that came in contact with the client is accountable for.
Absolutely.
I mean,
Absolutely.
something happened, and when the nurse was doing rounds, which have happened, and it says that during rounds, nurse went into the patient's room and found him or her on the floor. It's like, okay, and what did you do?
Exactly.
What happened prior to that incident? Was there a change in their medications? Did they seem their appearance as they were in prior days? Or did they seem like kind of off?
And then what happens many times too is they don't always write everything. They sometimes leave things out. And what we've discussed about many times is at the end of the day, the truth comes out. And these are the things that for us as attorneys is really important to do all the investigation along with the doctors, with you guys, because, for example, one thing I was, bed sores, they're called ulcers also. So they can put on their chart in the nurse's note, turn patient, every single shift, turn patient, and then you look at the patient behind and there's a humongous ulcer. So there's a big discrepancy there because if they're
Exactly.
turning the patient, you wouldn't have an ulcer, right?
Mm-hmm.
So, so these are the things that are very important in determining how our loved ones are being cared for.
Exactly. And on that point, in regards of how they document things on medical records, it's also really important to know that the fact that they are reporting in record that they did the turning and positioning, that they rendered the due care, which is a line that we see repetitive in all their notes, that all due care was rendered. What type of care?
Mm-hmm.
Because
Tell us
it
specifically.
seems like
Yeah.
a script that they just copy and paste on all the notes just to cover that, okay, I was working, I had to do rounds at that time, all my notes are properly redacted in the system and everything, but it's not as simple as that. Because, for example, we have cases that nurses are just checking on the administration of medications or administration of wound dressing changes, uh, stuff like that. And we see there's a specific part of nursing home records that is the medication administration or the administration of any orders that were made by the physician. And in these cases, it's like a chart where they are supposed to sign their initials at the time that the care was provided. And it's so repetitive when they just sign on it and just to cover that, yes, I did it, it's done, okay. That they keep on reporting it, but we carefully just check for like all the dates and all the days, and if that medication was to be given 3 times a day and you only provided it in the morning and before bedtime, like what happened that you missed a dose? Or they check like, yes, a client was assessed weekly for any changes in their skin, and it turns out that at some point our client had a doctor's appointment outside the facility, or maybe he or she was transferred to the emergency room because they started coughing or something, and they send them there for further evaluation. But when I go and see the records, it's checked like
As
they
if they had
made
done
their
it.
rounds
Yeah.
and they provided all the care, and that they
I know.
gave them medications or check for vital signs. And I'm like, why are you checking as if you did all of this when we have records from the hospital
Right. That
that
show they weren't
clearly
even
state
there.
they were
Right.
not at the facility. So
Right.
things like that are
And
clearly big issues that we can easily find in records, but also there are some things that doesn't show that are more progressive, and then you need to be paying close attention to it because it's not something that from one day to the other you're gonna see like a really significant change, but we have records for months or years, and you see and we're able to see
the progression,
the
right?
progression, the client deteriorated in their condition.
Right. And these are things that are very important because we're talking about people who can't always communicate, right? And or they're afraid um, to say what's going on. And obviously, the family members, when they go to visit, they're there for a limited period of time. So it's important to keep an eye out for these little signs
Yes.
that can be very big, very significant. They stop, they don't talk the way they used to. Um, like you
can see
mentioned,
changes
losing
in
weight,
behavior. Yeah.
all
and
these things. And it's important that at that point, you think about reaching out to an attorney. And our firm, we specialize in these type of cases. It's important that you reach out and that we can then commence our investigation and with the doctors and everything and determine what has really happened here. It's we lose our faith in the system, and understandably so, and it makes complete sense. But at the end of the day, we want to make them accountable.
it's their responsibility
Exactly,
to
exactly.
provide the standard of care. It's as simple as that. It's not that they are asking like something that's out of their hands. It's what they are intended to do.
Exactly.
And also, don't rely only on the attending physician of the facilities because each client has their own medical conditions, and they have to make consultations for wound care. For if it's a diabetic patient, they have to make sure that their diet is the correct one because if blood sugar levels get messed up and they're not in their correct level and not and everything is not like they're not getting their insulin or any type of medication that they are given to regulate and maintain stable blood sugar levels, that puts them at risk for any infections, any pressure injuries or pressure ulcers, and also like something that we are seeing currently in a couple of the most recent cases that we have are patients with dementia. And
Correct.
for elder patients, that's something that's it's something that tends to be pretty common around a certain range of ages. So, and that doesn't mean that because it's a dementia patient and they're not reliable with how they are like telling the history or the story of how things happen.
Right.
That doesn't mean that their complaints can be dismissed.
Exactly. I mean, their pain and suffering is real, whether they have dementia or not. And those are things that we always have to keep in mind because these are, again, human beings, our family members, our loved ones who are being neglected.
Do you remember the case that we had that it was an elder patient with dementia and the staff was just complaining that the resident wasn't being I'm just thinking how
Cooperative
they
or something?
like they weren't cooperating or so, and it's like, okay, maybe you don't have all the tools needed, so why don't you just make a consultation to neurology or psychiatry? Because that's why there are medical specialties
Right.
for each one their own, you know.
And they all should be involved in the
Yeah, in the
care of
care.
every patient. And
And
I'm so sorry,
yeah,
I keep saying patient and resident. We say it interchangeably. Patient is technically in a hospital, and resident is in a nursing home, but we're using them interchangeably. Just wanted to bring that up.
yeah. So we have that client that because if he or she wasn't cooperative with the instructions from nurses and the staff, the doctor then thought it was a good idea to make a prescription for Xanax
Hmm.
because they were seemed as being aggressive because they weren't following instructions as they were told. But then it's like, wait a minute, you know, like you need to see the our clients, we see them as a whole, not just something specific. It's
Hmm.
not just that they have dementia and that was the injury that was like mistreated for that. It's that one thing affects all the others, and just because they have dementia, that doesn't make their additional medical conditions less important. So
Right.
you need to be very careful when you make a prescription for something, just to be aware that they might be interactions between medications, that they're
I'm sorry, how does Xanax, what kind of medication is that first?
so Xanax is it's a sedative basically, and it's commonly used in psychiatry or neurology when they are like changes in behavior, and
But
and
how can
a
it affect,
person.
I'm sorry,
Yeah.
how can it affect a resident who has some other type of compromised medical condition? How would, why is it important to know as a doctor,
Hmm.
you don't want to give somebody Xanax when they have this other underlying issue. Can you explain a
Yeah.
little
For
bit about that?
example, a basic is diabetes. So you know that when people get like low levels of blood sugars, they tend to be like really calm or drowsy or sleepy because the body needs sugar to work, and when it's the levels are going down, the body cannot function properly. And if you give a medication like Xanax, when it's said to like make the person really calm and just at ease, you won't see a change in the appearance of the person.
Hmm.
So you might like misinterpret how the appearance and how the person is behaving as oh, it's okay, we gave him Xanax and now he'll probably fall asleep, and you don't check or have a concern that wait, we just gave him his insulin. If
Hmm.
he falls asleep for a prolonged time, their blood sugars are gonna be down,
Hmm.
extremely low, and that has
Hmm.
repercussions. Also, elder patients have more increased risk to have respiratory problems. So patients with COPD,
What
sleep
does
apnea.
COPD stand for?
COPD is so it's chronic obstructive pulmonary disease, and it makes it difficult for a person to get proper oxygenation into their system. So if just by having the diagnosis, it's even difficult. It's more difficult in comparison to a healthy person for them just to get the oxygen like properly delivered throughout all their system, and you give them a medication that tends to make them drowsy or maybe just fall asleep, or or
Hmm.
it just
Yes.
sedates them,
Right.
then you increase the risk of getting them to have even more trouble uh, with their respirations and
Right.
things like that.
And
So
and unfortunately and very sadly, ultimately, many of these patients, these loved ones, pass away And it's important to know that on the legal end of it, um, they have the right to have justice even if they've passed away. And the family members can absolutely contact us and reach out, and we can represent the family members, and it would be through a process with the court. But it's important to know that they're still going to, we can still make them accountable even if our loved ones are gone. And there's obviously no way of bringing them back, but we can at least get some justice for them by making these nursing homes accountable and responsible for what they're doing.
And that's our job. And we will check everything on the record, check for what's missing, for what they provided us, because sometimes we always request the entire medical record, but we might not get them.
Right?
Like sometimes they disclose whatever they seem appropriate for them to disclose. And that's something that it's always in constant communication between the medical team and the legal team, just to say, hey, you requested all of it, but the records that I have for review, they're incomplete.
Right. Like, for example, this patient who fell 20 some times, how come we don't have every single incident report, every accident report in the records that they provided to us?
And there are multiple orders from the physician in the record, but they didn't disclose the progress notes from the physician. So it's
exactly.
like, are these orders being placed through the phone? Like, was the doctor called and then an order was given to the nurse just to either change in medication, or if there was any changes in blood pressure or anything, it's just, okay, so let's discontinue the medication that the patient was on and just change it for another one. Like, that can be done, but at some point, that physician needs to be present, like in person, and be at bedside and examine the patient.
Exactly.
And just confirm that what was given was the actual order that they made, because things can happen. They're human. There can be errors, but you're not just managing whatever. You have lives
Exactly.
in your hands.
Exactly.
And
you have to go above and beyond in order to meet the standard of care. We're still talking about what just the basic standard of care under the law is. So it's important to remember that, what you're saying, yes.
And just really important for families to know that no concern is to be dismissed. Like, for any question that you have, you need to go to them, and you have the right to ask them for an explanation.
Exactly.
And
no matter how insignificant they may say, oh, well, he or she wasn't hurt, because we see that all the time, right? Fall, no injuries. Fall, no reported injuries. Well, they're entitled to know every single time.
And how they assess them. Because it's
exactly.
like, well, we checked them and they were not bleeding. You didn't saw like any bone like coming out of the skin or so, but that doesn't mean that a fracture didn't happen.
Exactly.
Which is what happened with our client in regards of the hip. And the thing is that for that specific case, our client was admitted to the nursing home facility just for rehabilitation.
Exactly. I mean,
it's just for
incredible
for
that
short term,
right?
And because of the negligence on their end of not being thorough and just dismissing the frequent falls, they didn't escalate the protocols and the interventions that they are supposed to implement and put in place, because it's okay, one fall can happen, but what did you do after it?
Exactly.
Did you just change something in the interventions that you had made initially for our client? Did you say, well, it's a dementia client and they need redirection uh, repetitive
Right.
redirection. So they are in the last room of the hallway. Well, then let's change rooms and put that person closest to
The
the
nursing
nursing.
station, right?
Exactly.
It's
So
just,
that
it's
you
so
have
simple.
like access to
Right.
being just able
Exactly.
to check on them.
And you have some patients and that really do require sometimes one-on-one.
Mm-hmm.
And again, it's not an outrageous thing to expect these places to do for our loved ones. It's not. It's not that we're asking too much. And
No.
going back to the expense issue that you brought up earlier, I mean, you have a lot of these facilities, they do take Medicare, they take
They
Medicaid,
charge a lot.
but yes, they charge a lot. And then at the end of the day, you know, the family members feel responsible for that too. Because, where is the Medicare? I think that if you have any assets, they're allowed to take them. I mean, it's such a difficult situation for the loved ones to be in. And it just, again, it breaks my heart
It's detrimental
reading.
for the whole
It
family.
is for the whole entire family. And when we read these charts, and I mean, I cry
Mm-hmm.
because you read how this person was so upset and complaining and crying. It's documented there, and yet they did nothing for the person. So definitely contact an attorney, contact our office, because that is not okay.
If you see any bruising, for example, just take a picture. Take your phone out, take a picture of it,
Hmm.
and just when you go in for the next visit, you can compare. Did it resolve? Is
Hmm.
it the same? Did it have been like? Did it worsen? And just and ask, like you don't have to feel like they're not doing you a favor. You're
Exactly.
paying for a service,
Yes.
and they're not doing something that's out of the ordinary for them. It's just what they are required by law to do. So it's your right. So you need to like go through with it and just ask them. They have to be held accountable. They have the responsibility for taking proper care, and you have the law by your side. I mean, that's non-negotiable. And
Absolutely.
standards of care, it's the word says it all. Like
Hmm.
there are standards, and it should be the same for everyone.
Thank you so much for joining us for this episode of On the Docket by Napoli Shkolnik. Thank you, Nicole, for joining
Thank you.
us. And if you want to keep informed, you can like us and follow us, and we will continue to help everybody in this personal injury world. Thank you.